Disaster planning. Types of disasters and response to disasters. FEM, a level of disasters and nurses' role. The Federal Emergency Management Agency, or FEMA, states 3 types or levels of disaster response. These are Level 1 disaster, Level 2 disaster, and Level 3 disaster. In Level 1 disaster, the President declares the disaster and there is full federal involvement and support. The support may be healthcare, emergency, shelter, food and supplies related. In Level 2 disaster, there is moderate federal involvement or support, and this too may be started with presidential emergency declaration. In Level 3 disaster, there is minor disaster and small federal support. So, what could be the nursing role in FEMA disaster? A nurse or any other healthcare workers have a major role in the FEMA level of disasters. The role involves being prepared for emergency drills, train in disaster management and CPR, make personal, professional, and family preparations, such as making licenses, credit cards, cash, cell phone, water supply, ready-to-eat food, backpacks, etc. accessible. Read and get acquainted with disaster management plan in the hospital if any disaster takes place. The U.S. President declares a regional disaster for a minor flood accident for a region and also small federal support. What type of disaster does this fall in? Your options are Level 0, Level 1, Level 2, Level 3. Types of disasters and phases of disaster management. Any disaster could be human-made or natural or internal origin or may be of external origin. There are 4 phases of disaster management as identified by the Federal Emergency Management Agency. Phase 1 or mitigation. Phase 2 or preparedness. Phase 3 or awareness. Phase 4 or determination. Mitigation. Mitigation means reduction. Mitigation involves any actions taken so that the damage of the disaster is reduced. So, what falls in the mitigation plan? Any activity that reduces the effect of disaster. Any activity that involves the planning of activities and resources and predetermining risk in case of disaster. Preparedness. Anything that involves planning and being sure what to do in case if disaster happens falls in preparedness. Some activities in preparedness are mock drills, emergency plans, plan for disaster management, allocating people, training and formation of disaster response group. Response. Response is related to taking actions. The action is focused mainly at saving the people's life. Recovery. Recovery phase is mainly related to restoring to the condition prior to the disaster. A nursing team is set out for an emergency drill to prepare for a possible disaster event in the future. Which of these phases of disaster management does this activity falls in? Your options are Phase 1 or mitigation, Phase 2 or preparedness, Phase 3 or awareness, Phase 4 or determination. The correct answer to this question is preparedness. Some activities in preparedness are mock drills, emergency plans, and plan for disaster management and training.